United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to welcome everybody here this morning. We are going to practice wherever possible, social distancing. If you can't, make sure you have a mask available. We are going to obviously have a public comment session. Anybody and everybody that wishes to speak will be accommodated. I'd like to remind you that during that time when you are giving public comment, we do have a rule of 5 minutes. So, Mr. Clerk, would you call the roll?
Certainly. Patrick.
Here.
Bruner. Lorenzen.
Here.
Farnham. Chittick.
Here.
Ludington.
Here.
Voigt.
Here. A quorum is present. We'll move on to the next item, which is the approval of the minutes from April 8th, regular meeting, April 20th, special meeting, and April 27th, special meeting. Gentlemen, you've had those in your possession. Is there any addition or corrections to those minutes? Hearing none, I'd accept a motion for their approval. Phil moves.
Second.
Derek seconds. All those in favor signify by saying aye.
Aye.
Opposed, same sign. They are approved. Thank you, gentlemen. Next item, claims against the county. Likewise, you've had those for several days. Are there any questions or clarifications needed? Hearing none, I'd entertain a motion to approve the claims presented on the county. Derek moves. Andy seconds. Any further discussion? All those in favor signify by saying aye. Aye. Opposed, nay. They are approved. Next item of business is the county board claims. Are there any questions on those? Hearing none, Phil moves their approval. Is there a second? John seconds. Any further questions? All those in favor signify by saying aye.
Aye.
Opposed, nay. They are approved. Now we come to the portion of the meeting for public comment, and we're looking forward to that. We have a podium up front. Anybody who wishes to make a comment or have ideas for us, we'd appreciate it. We only ask that you identify yourself by name. And so the podium is open to anybody, and we ask you to keep your comments to 5 minutes. So I invite you to the podium and offer your comments. Please.
Members of the County Board, good morning. My name is Pam Ludington, and I'm here to represent Soleil Body and Tanning Salon. I'm here to encourage you, the County Board, to expedite the reopening of Edgar County as soon as possible. At Soleil, our owner, Leslie Mills, has a working plan in place as soon as we reopen. We will be taking every precaution recommended by the health officials to keep our clients safe. We as a community cannot survive much longer being shut down. Soleil, I feel, is an essential business. We have several clients who tan due to depression, skin disorders, psoriasis, and there is absolutely no reason why we cannot open this county up. Please take into consideration that Edgar County has had no one tested positive for COVID-19 as of May 13th, 2020. Thank you for letting me address you today.
Thank you. Appreciate it. Next folks.
Thank you, Chairman. My name is Kirk Allen. I want to go over some information that we've uncovered and actually published last night. And I want to make some points that I think there's a lot of confusion as to what can and can't be done. To everybody that's viewing, the county board never closed you. Government doesn't have the power to just say you're closed for business. Under our Constitution, both state and federal, you have due process rights. Those due process rights have to be followed before somebody could just shut you down. We challenge anybody out there to disprove that. The courts have cited on this many times. Case law is on point. we uncovered an Attorney General opinion that was directed to the head of the Emergency Management Agency. And within that opinion, it's dated July 2nd of 2001, and it was on the subject of the 30-day powers. And everybody's been talking in the news, how long can this go on? And the governor has argued it can go on as long as he keeps making proclamations. That is not what the Attorney General has said. They specifically said he has to go back to the legislature to do what he's doing. This is being ignored. That process is the due process. The legislature is the checks and balances, and that opinion, and it's published online now on our site, that opinion has all the legal foundation as to why he can't do what he's doing. So if that gives some folks a little bit of comfort, that's one. Wanting to reopen, you folks never closed, so there's really nothing to reopen. Businesses voluntarily close their doors based on what they heard on the news, social media. Unless someone came and knocked on your door and said you are closed and gave you the chance to exercise your due process rights, you're not closed. We closed because we chose to follow a path of an unknown. We know a lot more now. Through that process, and Chairman, I believe you've got these documents, we'll make these available also on our site. In the Health Department Act, it outlines specifically what they're supposed to do, how they're supposed to close, if they're going to close you. The government has the burden, and this is a quote right out of the law, by clear and convincing evidence must prove that the public's health and welfare are significantly endangered by a person, a group of persons that is suspected of having, that has been exposed to, or that is reasonably believed to have been exposed to a dangerous, contagious, infectious disease. There's a due process court order system they have to go through to close your doors. Okay? They can't just come in and say, you're closed, period. If they give you a cease and desist, contact your lawyer, do your own research, read the law. It's real simple. You can voluntarily close or invoke your due process rights. There's sample letters that people can follow online. The attorneys have not lost a single case, and I believe this very letter that was sent out by Tom DeVore with Silver Lake Law Group, one of them went to our Edgar County State's Attorney, went to the Sheriff, and went to the Health Department. They chose not to seek a court order. Why? Because they don't have the foundation to support closing the business. They have to have evidence to close you that you're a risk. Without that, it can't happen. The other side of it is a concern over the Liquor Control Act. This is directly from the Liquor Commission. Since the governor's executive orders are made pursuant to Emergency Management Agency Act and not the Liquor Control Act, a violation of them is not a violation of the Liquor Control Act or its rules that would allow the commission to suspend a license. So when they say we're going to take your license, they can only take your license if you break Illinois law. Executive orders are not Illinois law. Legislatures make law, not governors. Governors have orders and they have certain powers, and those powers are limited. There is a process of due process rights for your liquor license as well. To be threatened is one thing, but we all know when you have to resort to being threatened, you're no longer leading. There's a full breakdown on the barbershop, salons, and cosmetology issues as well. There's a due process right. No agency shall revoke, suspend, annul, withdraw, amend materially, or refuse to renew any valid license without first giving written notice to the license of the facts or conduct upon them the agency will rely to support its proposed action and an opportunity for a hearing in accordance with the provisions of the Act. Due process. They can't just close you down. Those that voluntarily did, all I can say is you made that choice. On the Salon and Cosmetology Act, there are two criteria to think about. I believe it's 2F, failing within 60 days to provide information in response to a written request made to the department. So if they came and said, hey, here's your cease and desist, and you took 60 days and didn't answer, they could take your license. Under J, continued practice by a person knowingly having an infectious or contagious disease. Well, if they know that, then that's a valid reason to shut you down. If the health department knows that, they can shut you down. All these documents are available, but understand you chose to close. The county never closed you. The county doesn't have the power to open you. All they can do is point you to a lot of good information and support what your rights are. Thank you.
Thank you, Kurt. Next person, please, who would like to address us?
Is there anybody else in here that wants to address?
Yeah, that's it. For whom don't know me, I am Madison McCarty. I am owner of Old Heritage Beauty and Boutique here in Paris. I have a lot of my fellow salon friends out in the hallway due to the social distancing that can't speak, so I'm speaking upon all of us. We were shut down on March 22nd. There was no really warning. It was a 3 p.m. speech said that we had to close the next day at 5 p.m. Since that day, I think there's been a lot of confusion that we have gotten self-employed, grants, all of that. Most of us have not received a penny. A lot of us have not received stimulus checks, so there has been no income since then. And in all the salons in Edgar County, I don't feel that there is ever any more people in our salons than there is not even close to Walmart. And to get our license, we have to complete several hours of sanitation, test through sanitation. So this is already stuff that we've been practicing our whole career. So stepping up the game is definitely something that we are doing. We were already doing that before shutdown. But we don't feel that it is right that we should continue to be shut down, especially with these bigger Walmart, Real King, all those corporations being open. So we would like to see what we can do to get open as soon as we can. And we are willing to take those extra precautions as well. Thank you.
Thank you, Madison. You got anybody else up there?
Oh, yeah. I'm just checking, no one else in here, correct?
Good morning. My name is Dustin Reed, the owner of On the Tracks Cafe here in Paris. I'm not very good at talking in public, but I'll give it my best shot here.
You'll be fine.
We are hurting really bad. My wife already works outside of the restaurant. I took a job working with a township outside of the restaurant, so I didn't have to let anybody go. We did get the paycheck protection. That did help, but what a lot of people don't understand about restaurants specifically is how much money goes out. It's constantly, the water bills haven't changed, the electric bills haven't changed, the mortgages haven't changed, the insurance none of that has changed for us. The only thing that has changed is obviously the food price goes down by how much food you buy. That's the only thing that goes down. Everyone's still on the payroll, everyone's still getting the regular hours, because that's what I want to do. I could let people go, work there myself, but it's not right. We have a little bitty room, smaller than this room. So for us to even open at 50% capacity would give us at best maybe 5 tables if we move things around. So table 1 has 1 person, 2 people, 3 and maybe 4. I mean, we're at 10 people for lunch. Our prices, everyone knows, everything's under $10 there. We just did a $100 lunch. That doesn't work. We're doing okay right now. We're staying afloat. Even to open at 50% would hurt us even worse, unless we can try to do both, curbside delivery, I guess all 3, curbside delivery and let people come in. My biggest issue with everything, and I haven't, all night long this late, what happens if we go forward, and I'm not saying either way what I'm for, if we go forward and open up things, we still have the health department to deal with. How do we know that they're not going to take our permits away from us? I don't know. I can't get a clear answer on it. I wish we could. That would give me and a lot of people in this town peace of mind of, is the health department going to come in and take our permit if we open the county and do 50%, even though we're not supposed to according to the governor. So I guess that's my biggest issue is the permits and who's going to take those from us. So I appreciate your time.
Thank you. Hi, Jill.
Good morning. It seems every time I'm here it's to make an impassioned plea, and today today is no exception. I'm here this morning because I feel like the state of Illinois has failed small businesses in Edgar County. The only thing that's in the governor's executive order for our business, the Bloomfield Barn, is uncertainty. And I can tell you that there's nothing that'll kill a business quicker, not even a virus, than uncertainty. I spoke at length a couple of days ago with Steve Horvey, the developer of the Hampton Inn project here in Paris. He's been our strategic business partner since the first idea of a hotel in this area crossed everybody's minds. And he shares our concern. And at the heart of that concern is uncertainty. And just a few miles east of here, across this invisible border, that uncertainty doesn't exist. They know, for example, what size gathering they'd be able to have in mid-June or mid-July. They know when they can once again have family-based, faith-based, community-based meetings and events. They can answer their clients' questions, and so they can keep their clients and they can keep their business afloat. So on behalf of the small businesses in Edgar County, especially those in the hospitality sector, we need your help. We need you to eliminate that dreaded uncertainty. And we hope that you don't make the same mistake that the governor has made, which is treating us like school children. Like, if we're let out, we're going to misbehave. I can assure you, on behalf of my business and others similarly situated, we want to be allies with the county board, with the health department. We want to keep Edgar County COVID-19 free. We're proud of that. But we need a lifeline, and we need it now. Because relief further delayed is no relief at all. So, if you can help us where the state government has failed us, then we will help in return by continuing to add to the tax base in the county that funds the schools and funds the public works projects and funds the public salaries. So if you let the Bloomfield Barns and the Hampton Inns and the countless others fail, the county fails with them. So I certainly don't envy you the task ahead of you. It's a difficult one as you try to take our county forward. We're certainly willing to help in any way, but whatever you do, don't back down. Fight for Paris, fight for Chrisman, fight for the home team. Thank you.
Thank you, Jill. Hi, Tom.
Hi, how are you? Crazy times. You know, I think everybody probably knows me. I'm Tom Dolan. I am the owner of Tom's Fitness and Martial Arts, and this has been difficult for us, as it has everyone else. And once again, you guys are thrown into a very difficult position. I understand that. And, you know, as a business owner, when this came down, we're looking at the data and what they're saying, and we're like, yeah, we need to do it. We have to help. I think everybody would say that. And what we've seen over the last 2 months is the numbers keep changing. It seems like the goalposts keep changing. Originally, we wanted to stop flatten the curve so that the idea was the hospitals wouldn't be overwhelmed. And I think we did that successfully. So much so that you look at both coasts and those big ships that were moved there to help, they're gone. McCormick Place, all the money that was spent on that, they're not using that. And we've been really lucky in our community. We don't have any confirmed cases. I think people would probably say it's been here. I get that. But our system is okay. We are in a unique island in Illinois. And we're sitting here going, why are you making us follow a protocol that was based on the worst case scenario that was proven to not actually happen? Things changed. They kept changing the numbers, and we're happy that that changed. We're very happy, right? Nobody wants to see anybody hurt. And we want to be reasonable too. We want to do our part. If they said, okay, 2 weeks and we're going to let you open on a limited basis, I think most of us as business owners would go, okay. You know, we've said okay several times. But what we're hearing from the governor is that we're not going to have the peak until the middle of June. First of all, tell me where that's coming from, okay? Because they keep changing the numbers on us. And then he says, and we're going to need 30 days to evaluate that. So what are we talking about? The middle of July now, before we even can begin to open up? I just want us to be reasonable. Things are not the way they are in Chicago. We need to be treated like Edgar County. you know, Clark County did their thing, and I'm happy for them, and I get that. I don't know what you guys can do, but we need to take a close look at what we can do in our community based on the facts here in our community. That's what I'm here for. I would love to see us be able to open on a limited basis. As a fitness center, we never had more than 10 people in there at a time anyway. And we cleaned the crap out of that place all the time. And we taught people how to do it. And they did it. I watched it happen. You know, I don't know how much longer our members are going to put up with us not being able to provide them the service that they want and need. And then finally, the last thing that when I try to be an objective individual, right? I think most everybody in here has some sort of ties to business. Look, we want to do our part, but when is enough, right? When does it end? You know, we can social distance in there. We can clean. I've been doing Zoom classes for our martial arts people, and that's a great service I'm providing, but I can't do that for the fitness people. And the fitness people need to be able to take care of themselves for social, for health reasons. I mean, there's a lot of evidence that if you take better care of yourself, you're healthier. And now they're supposed to sit at home. There's nothing they can do. It's such a difficult thing. I get it. And I just would implore you to look at the facts on the ground. You know, why are we taking the governor at face value without hearing from the medical experts that he is saying that he's listening to? You know, and why do the goalposts keep getting moved? We're going to take time to flatten the curve, and then we're going to slow the spread. And then we're going to wait till the curve is even flatter, and then it's got to go down for a month before we can make any changes. It's starting to become ridiculous. So please, please, look at the facts on the ground. You know, I'm willing to work within the federal guidelines. What the federal people say, this is what we need. It's not Chicago. We are in Illinois, in the middle of the state. God help us. Thank you, guys. Appreciate it.
Thank you.
Good morning. I was not expecting to speak today. My name is Virginia English, and I am a minister from Restoration Life Global Ministries. I am thankful that you guys have opened up the podium for us to speak here today. And like I said, I wasn't prepared, but what I have to say is just short and sweet, and that is I believe that we need Jesus Christ more than ever right now. The suicide rate is high, and I have members of my congregation who have become depressed and in very much need of the church today. I know during World War I and World War II, the Civil War, the church was never closed. And I feel in my faith that it is something that is definitely needed during this time and season. So I appreciate you allowing me to speak, and God bless all of you for your work and time. Thank you.
Thank you.
Good morning, gentlemen.
Good morning.
My name is Kyra Taylor, and I am a resident of Edgar County. I am here today to show support for our small businesses here in Edgar County. We live in a state where we have a governor that doesn't understand what life is like in Edgar County. He doesn't understand what life is like for small businesses, and he doesn't understand what life is like for your average American. The governor's current order is having a huge impact on the economy across the state, especially in areas like Edgar County, where our small businesses are vital to our economy. The impact of this lockdown is going to cause us to lose a lot of businesses and a lot of jobs. It is also going to drive a lot of our residents' business to Indiana because we don't have a viable choice here in Edgar County. I would like to see the county board stand up and stand behind the rights of our business owners and stand up and stand behind the rights and well-beings of our residents. Because we rely on you as our county leaders to be our voice. And I think it will take the leaders from all of downstate Illinois standing up and telling the governor that, hey, we are not okay with what you are doing to our economy. And our life here is a lot different than what life is in Chicago. So I would just like to say, on behalf of a lot of the residents of Edgar County, we would like to see you guys stand behind our small businesses in support of opening them up. We know that you don't make the ordinances. We know that you cannot stop the state's actions, but we would like to see you be our voice for the residents and small business owners of Edgar County.
We're checking with the rest of the folks outside, see if there's anybody left, because I think there's only like one or two, if that many. So,
Thank you, Derek.
Yeah, I was considering this would be a good time to explain what we're doing when we're talking about.
Good morning, sir.
Morning. My name's Steve Hood, Kansas, Illinois. This really doesn't have anything to do with opening up the businesses, but something to take into consideration when you're thinking about this. From everyone I've kind of discussed with and talked to, have no actual information on it, but back in early February, quite a few people were already down with the same symptoms, the same everything. I know my daughter works for the state of Illinois. She was down for 2 weeks with all these symptoms. 50% or so of the people in the state of Illinois offices were down. NAL was down. They'd said an Asian group had come over and turned the plants and stuff, and right after that everybody started getting sick. I don't know that they've decided for sure whether or not you don't have it after you've had it, you know. It's something to consider why there's no cases in Edgar County, is because it went through here in February. And, you know, that's a big thing, but that many people were sick and everything. So
Thank you, sir.
got two more.
That's fine. Hi, Cindy.
Hey guys, how are you? I'm Cindy Patrick, owners of Andrews. I think, you know, we're all here saying the same thing. I know that you all want to open this as much as we do. I'm listening to people out there, they're even afraid to come in and talk. They want to speak out, they want to open up, but they need guidance. They need someone to do it for them, to open it up for them. They want you guys to be their voice, but they're afraid. They're afraid to open up. When you ask them, they're desperate to open up. They're losing their businesses. There's a gal out there, she's a hairdresser in her home. She hasn't made her mortgage payment for 2 months, and if she loses her home, she also loses her business. It's right there. But she has to open up. She said, if I have to put black curtains in my windows and do hair in the dark, I'm going to have to, because I'm running out of food in my freezer. You know, they want to throw the doors open. They want to defy the law. They want to just go ahead and open up, but they're afraid to. They're afraid of what the government's going to do to them. You know, we have an Edgar County Health Department. It's an Edgar County Health Department. In my view, the Edgar County Health Department needs to be standing up for what's right for Edgar County, not what's right for the state of Illinois. We've got that coming down from the governor. We need them to advocate for us. Give us the guidelines to open. Tell those people, tell them, go ahead, open up, throw your doors open. Thank you for your statements. Let them know it's safe to just go ahead and do it. They can't come and arrest you. They'll have a jail put us in anyway. But they can't take you away. They have to serve you with the law. And the law is not behind this. So please, I know he hears it all the time, but I want everyone to hear. They're looking to all of you for the answers. And I know you won't give it today. I know you're just listening to everyone, but please give it to them. Thanks, guys.
Thank you, Cindy. Good morning.
Good morning. I'd just like to say that I'm here on behalf of all the small businesses in our town. I do have a resale shop I just bought last year, and I would like to open this month. You know, it's hurting everybody because of the governor that doesn't understand what's going on here in our small town that's not had 1K. Who is he to say what's essential and what's not, when there's other resale shops that have stuff that people do need? I just don't think we should have to pay because of Chicago. And I know you guys you can't make a decision, but I'm just asking you to consider us, you know, let us open again, because it's really hurting our economy.
What's your name again, ma'am?
My name is Donna Inman.
Thank you, Donna.
Thank you.
Hello, my name is Philip Stapp. I didn't prepare anything, and I honestly came up here just to watch. A lot of folks are coming up here, and I understand the passion and wanting to get back to work and get back to your livelihood. I get it. I worked at North American Lighting. I recently started back at North American Lighting, and I increased my salary by a fair amount. And because of this shutdown, I had to leave my work. I applied for unemployment. Unemployment was not willing to pay me, so I had to go back to a very low-paying job in order to take care of my family. There are jobs out there hiring. If people want to work, people can certainly work. There is unemployment. I understand people are having a hard time filing for unemployment. There are also SNAP benefits that people are eligible for regardless of how much money you make, providing you are not able to work. Everyone's saying that there are no cases in Edgar County. We have tested 190 people out of 17,000. Would you take those odds for anything else? I'm sorry that I sound so passionate about this, but everyone else got up here and they were so emboldened, and I understand it. You are losing your livelihood. I was losing mine. That's why I went out and got a job that's barely paying my bills, but it's feeding my family. As for the North American Lighting comment, North American Lighting comes out of Japan. It does not come out of China. I'm sorry, that was not a comment that made any sense and was not prudent to this argument. North American Lighting is not responsible for Edgar County getting coronavirus or not getting coronavirus. Like I said, I did not come in here prepared for a statement. People that are yelling at J.B. Pritzker to open the government, why don't you guys look at how we can help our small businesses until they reopen? Anyone that goes to On the Tracks or goes to any of the local restaurants here in town, are you ordering out? Are you continuing to support them? Or because you can't go there, have you stopped buying from them? Because if you have, you stop supporting them, you're not supporting local. I don't have a closing statement. I just wanted to get some of those things out there for everybody because, as Cynthia said, there are people like myself who are afraid to come out here and say things like this because I am certainly the minority. I would also like to point out that of all the people that came up here and said, we are willing to follow the rules and wear masks and take precautions, I believe 3 of them wore masks into this building. As I look around this room, barely anyone is wearing a mask. If the camera was to turn around the hallway, you could see masks right there, but if you go out further, you can't. So, saying that you'll follow rules and actually following rules are 2 very different things. We all have relatives, we all have loved ones. No one should die over this. No one should die over something preventable. Thank you.
Thank you, sir.
My name is Sharon Nichols, and I don't talk in public, but I do have to make a comment on that. He's talking about that no one should die over this, but if you look at the data, people are going to die over this because of the shutdowns, because people suicide, whatever it be, drugs, but there are more people that will die from that than people that will die from the coronavirus. And that's data is proven, where the original data was not proven. 2-3 million people, that's proven data, and that's something that we have to consider. And we don't want to lose our freedoms. We do not want to lose our freedoms, and that's my biggest fear in all of this. Thank you.
Thank you. John?
John Pratt. I think the issue, well, I know the issue, is make the county health department serve you with the proper paperwork so you can either voluntarily stay closed or say, no, I object. Then they go to the state attorney who decides whether to take it to the circuit court. Then they have to prove their position, which they probably won't be able to. And if they can't prove your position within 48 hours, you're open and nobody can touch you. That's all I got. Thanks.
Thank you. Derek, do we have anybody else out there, please? Perfect. Good morning, sir.
Morning.
Oh.
I'm here for the restaurants and stuff, here for everybody, really. I would feel pretty bad if I gave it to somebody. I mean, I'll be honest with you. We're still out working, a lot of people aren't. People are hurting, and just like us, I mean, we're doing a lot of work. Not a whole lot of people paying, so if they can get back to work, it kind of, I mean, there's safe ways to go about this, I'll be honest with you. I've got a young one at home, so I'm kind of extra precautious, you might say. And that's kind of what this county had to be, I mean, to be honest with you. I'd like to see everything go back to normal, if there is a normal. That's about all I got to say.
Okay. Thank you.
Yep.
Anybody else?
We're good? Okay. All right, I wanted to point out a couple of things. I think it's in order that we have been speaking on the county's behalf, and we are in the process of doing more things. On May 7th, the board and the city and the Horizon Health Center sent a letter to the governor, and I'm not going to read the whole thing, but basically going, our track record is good, we are mature and responsible in how we are approaching the virus. We feel that our record should stand for a lot. We ask that you allow us to immediately move to stage 3 and 4. We sent that out last Friday to the governor with a hard copy and electronically. We have, at this point, that I'm not aware of that we have not heard back from him. Additionally, I talked to the mayor of Paris yesterday, and we're in the process of sending a second letter, drawing it up, asking him to please respond to the first letter so that we know how we can approach the problems that you brought to us today. Additionally, we are preparing guidance. I don't know how that's all going to work out, but guidance for the community and Edgar County on how to approach everything. I think that you each individually, as a business person, as a member of this community, need to approach in a safe, responsible, social distancing, masks, etc. way to approach how you plan to open your business either now or later. We're not giving you, because it's not our job to give or not give permission for you to open. We will try to do several things over the next week to determine how we can best alleviate some of the uncertainty that you've spoken to us about today. We understand that. And I think it's easy to say, well, you just do this, this, and this, but we have to solve some problems for you in a way that takes away some of the uncertainty. And we will endeavor to do that. We have a meeting planned for the first part of next week. Quite frankly, I would be surprised if we heard from the governor. I would be delighted if we did, but I'm not sure that we will. So we are going to have to step in and work together. Oh, my time's up. Step up and get a path forward that everybody can live with, and that we can keep our community strong and our people happy and strong, and give us a long-term, or short-term, but as well as a long-term future for this community. So we are committed to do that as a board, working with the hospital, working with the cities in the area, working with the health department. We will do those things, and you have decisions you need to be made to make based upon some of the things. We have some handouts about what you should do and can't do as far as your business. One of the things I would suggest, no matter what, if hypothetically you're saying, I'm going to open tomorrow, make sure you talk to your insurance people. Make sure that your liability is where it should be. You don't want to expose yourself to bigger problems. Not that you don't have big problems now, but you need to check with your insurance agents to make sure that you have the coverage for liability should, God forbid, something happen. All right? I would suggest you do that. And you need to do some searching of your own. Remember, I guess I don't mean to be mean, but you voluntarily closed based on what the governor told you to do. He didn't really, I guess you just decided you closed. Now you need to face decisions on whether you should reopen, when you should reopen. The governor's got a timeline that keeps moving. And I don't know whether it's 96 days now or whether it's May 29th. I don't think we know. And that's a problem. And those are some of the things we'll try to get clarity on. But that doesn't mean that you can't make decisions for yourself now. Okay? Gentlemen, do you have, on the board, do you agree or have comments? If you don't agree with me, that's fine.
I agree with you 100%. I want to tell everybody, I called my insurance carrier. I am covered, just as I normally would be covered. I checked that first. I think it's important to listen to what Kurt's pointed out, and that is, I invite everybody to take one of these sheets, not fight a little bit, okay?
I've got more
It's
here
a little
too.
bit of responsibility on you, but I think, I know what my stance is and has been, and I invite you all, you're gonna have to fight. Gotta take some of this on yourselves, okay?
Well, I think Kurt pretty much put it. I'm gonna take his word, he's never gonna
I've
be
been
wrong,
reading
but I
about
know
this,
him.
and yes. I'd like to know what, in Edgar County, what curve are we flattening at this point?
Well, and we're not saying that you're on your own. We both got to work on this. But you've got to make some decisions. In the meantime, we need to work to take away some of the uncertainty that exists. Okay? And I think we're all committed to do that. So we'll just try every means we can that makes sense and is a mature way to approach it with state government, you know. So, Derek, do you have anything you want to add?
No, there's a lot to think about and a lot of considerations. I think, you know, our biggest job right now is to give assurances to people. It was mentioned, you know, is the Edgar County Health Department going to take my license away? Things like that, right? That's not the case. There are things that we need to put in place, be aware of what's going on. There'll be a lot of information coming out in the next week or two as we try to find the best way forward. And that's both for the short term and the long term. So that's all I got right now.
John?
No, I think it's all been said.
We are extremely pleased that everybody has come to us today like they have. And we're encouraged by that, and we thank you. And we'll do our best. You are certainly welcome to call Andy. No. Get a hold of us. We're online as far as how you can get a hold of us through the clerk. And, if you have any ideas, please share. We'll try to be open and transparent about what we're trying to do. And we feel we've taken some initial steps that at least build a base on which we can continue to progress here. Okay? So, I guess that's it. Anybody else have anything to add? Again, thank you all. You're welcome to stay for the rest of the meeting, but if you don't wish to, you can boogie too. Okay?
Promise it'll be exciting.
Yeah.
Need a 5-minute break once the baseball.
Why don't we, that's a good idea, we'll take a 5-minute break.
4:51.
Because my,
Got more than 450 people watching.
well, good.
The camera's gonna stay rolling, we're gonna still keep broadcasting or streaming.
Okay.
Thanks for the heads up, I appreciate it. I'll try not to say anything dumb.
Some people need a heads up.
Excuse me, young man. Thank you, Derek.
I'm gonna go out, talk to Rich, he's out.
How are you? Good. Are you good? I have a couple of questions.
Agendas are right there on the corner of that desk.
Take a few if you want it. Well, I already handed it in there, pass out. Yeah. I handed it to your wife, I think. What did they do? They came back. Okay. Why as well?
Yes.
Baby steps, but, who knows what the new normal's gonna be anyway.
Worse off in August than we are now. Fix it.
I don't either.
And with that, you've got catering and things like that, which is a huge piece of the bottom line for any restaurant business. The catering business for restaurants, at least a lot of them, that's
Nice job.
one of the
Thank you. Thank you.
best money makers.
Catering.
Yeah.
You gotta be
A little
prepared.
all
You gotta
there
be
for a little
prepared
bit.
to do that.
People making money where nothing was to talk, so.
Do it in-house, but like when Marty's was open, that was his biggest money maker. Catering.
I'll leave it to you, you're in charge.
Thank you, sir.
But, if you're doing it at a venue, you're like, Track Shack, stuff like that. Other businesses on Main Street does, if you're relying on large, gatherings of people to cater as part of your business, we're a year out. I mean,
So you can't cater?
you could cater for groups of 10.
Yeah. Yeah.
That's not exactly a moneymaker, is it?
No. Yeah, exactly. By the time you're having groups like we used to have at these weddings and stuff.
Right, you can't have it.
The other thing I worry about too is if you go by some of the conversations being had, and that you've had, where does your liability coverage end? Now I'm talking on the flip side. So I, as a business owner, as a restaurant, decide, you know what, I'm gonna follow all the legalities, I'm covered per my normal, and I open up just as I was in February.
But
Where,
there's an amount of responsibility on you as a business owner, I feel. You can't open up like you did in February.
what is the enforcement device, what is your concern of doing that?
My concern is if someone gets sick in my establishment, how many people are gonna come after that? So
Strictly just from the business standpoint.
Just from a business standpoint, I mean, and a lot of it is personal responsibility. If you feel comfortable going to my place,
Well, and that's one of my concerns too, is opening up restaurants, and we talked about it a little bit, you know, you've got fixed costs, and at a certain point, if you're open and you're open at 25% capacity, are you ahead or behind from being totally closed?
25% would be rough.
That, I mean, I don't know, I rely on you to, you know.
But
you
on
see what
any
I'm saying?
given night, you can have a 25% capacity night, you make a bunch of money.
Right, the right parties.
I mean, yeah, you control what
And that,
variable costs you can
that's
control.
unique somewhat to you
It is.
in this area, right? There's a big delta between two groups that sit down at your restaurant, as far as like what they pay, right?
Right.
Because, you know, if I'm going big, it's gonna be different than just, hey, we're gonna have a meal, that's it, you know? So, but those are the questions I have, like, my biggest concern is trying to do the right thing and end up putting more burden on you. And so I just wanna know.
I don't think you put any more burden on what they got now.
Well, to that end, right, so, in part of this whole conversation, right, if we say, you know what, state government be damned, we're gonna open up and do all the things, we have a flare up of cases, and we're back to quarantine, there's some other, we have more news than we ever have. What is our ability to go back to the state and say, hey, help us out, right? And if the answer is we're in equal footing, that's one check in the box, right? If the answer is we're fucking luck, then that's a concern, right? And that's what I view our job as, is to decide how best to serve everybody, right? And part of that is have all the protections that we can possibly have. Part of it is allowing us to get closest to normal as fast as possible. And then part of it is just helping people that are dire straits. So it's a balance. Those are all the things.
Is Augie out there?
Yeah, we got some right here on the board. He's like, oh, I just read it. And it's not
I think that, and one I don't have a good answer for, I have no answer for is, Jill, you know, like, how do you schedule these big events, like, you can't.
Right.
Is Augie out there, John?
I didn't see him.
That's tough. You got an events place.
Yeah.
What do
He
you
had
do?
talked to my wife about it.
Yeah.
That's almost a separate issue, with a huge, they make money because of the big events.
Right. No, I mean,
The rest of it,
that's the.
control and much of it.
Right. I mean, that's part of it. I don't know. You know how you control it is you get as much back to normal as you can get.
Whenever you're ready, let me know.
In other words, you can't just keep it like it is right now. I don't think you can't keep it closed down like it is now, because what gets better?
Okay, we'll go back in the session from our recess. Next, do we have anything on the highway? I don't believe we do. Okay, next is resolution to set salaries for elected officials for the terms beginning 12/1/20. You all have a copy of that. There's basically virtually nothing changed in the wording of anything roughly, except the amounts for the circuit clerk, coroner. There's no changes in county board. So, anybody want to make a motion to approve the resolution? Okay, Lud moves. Derek seconds. Any further discussion? Augie, when you're ready, please.
Patrick,
Yes.
Lorenzen.
Yes.
Chittick.
Yes.
Luddington.
Yes.
Good.
That's good. Oh, the word's good. All right, can you call Dina? And we'll hold off on the next one, but Dina needs to get us what the bid is and how much money it is, unless she gave that to you. So we'll go down the list to number 11. Well, actually, first of all, do you folks from Horizon, Sam, do you have a report? Are you here? Are we holding you up? I mean, if we can, okay? All right. Next item, number 11, is to reappoint Dale English, Greg Henry, and John Shiddick to the Edgar County Farmland Committee. Any discussions? Motion to approve.
So moved.
Derek moves.
Second.
Lud seconds.
I'll second John.
All those in favor signify by saying aye.
Aye.
Opposed, nay. Okay, that's done. Next one is the ordinance to create Special Service Area Number 2 for the Northern Edgar County Ambulance Service. How did you do? Does everybody have the new, and how do you want to approach it?
Well, Robert just handed us the full document along with all the exhibits just prior to the meeting, but it's my understanding that the ordinance paperwork is the same as what you've already been given in your packets, minus all these exhibits, which are the parcel numbers, or the parcels of everybody that's in the area. So as far as that's concerned, the only thing that I understand as far as the blanks that need to be filled in are the tax levy rate and the assessed valuation of the new special service area.
Which you currently have now.
Which I currently have.
Dina got you that, yeah.
Yes. Yeah, we were just handed that.
All right, so we can go ahead and pass that, or if you want, do you think there's any reason, since we're gonna have a special meeting probably early next week, do you wanna double check that stuff, or what do you think is the prudent thing to do here? Be nice.
Well, you know, quite honestly, since it was handed to us by the council of the district, right before the meeting, we really haven't had a chance to go over that, plug in the numbers where they're supposed to be, so that we can say definitively, this is, you know, this is what you actually need. If you're planning to have a special meeting, I would table this until that meeting.
Can I ask a quick question on it before we get to that? When you talk about actually plugging in the numbers, will they be setting numbers before bids are actually out and then have it as up to, or? Because I assume the idea is to have the levy barely enough to cover the bid.
That's correct. Well, the bid could be less than.
Right.
Okay?
So in which case, yes, that's why I'm wondering just how we're plugging numbers in.
For that 1 year, it's gonna be for 19 payable 20. Okay?
It wouldn't be the first time we saw a bid that was more than the actual levy.
Well, yeah, that's why I'm wondering how we put the number in on the levy, if there has, or are they using the bid that?
It's at the direction of the state's attorney that he wants it in there for, as I understand it, for the current year. He just wants that in there to show what it would be if it was done right now.
Yeah, I believe the statute calls for that.
Okay.
Okay.
Is there any concern as far as our timeline goes?
Well, yeah, obviously, we can't wait another month.
But a week.
But we could wait a few days. It's not gonna hurt to make sure that we've got all of our I's dotted and T's crossed. Since I was here, and when the guy walked in with it this morning, I mean, it's...
Out of breath, sweaty.
No, I did look close enough to know.
Good.
Okay, so, what's your pleasure? I mean, we can go ahead and pass it, and probably be fine, but the
No,
numbers...
let's go ahead and wait.
Okay, motion to table then? Derek moves. Andy seconds. All those in favor of tabling this till the special meeting signify by saying aye.
Aye.
Opposed, nay. It is tabled. We also, well, I'm thinking about it because my memory isn't always great. We need to put in there for the special meeting this and the selection of the airport engineering. Okay? Okay, next item is a resolution to reappoint Bill McCord, trustee, Metcalf Fire Protection District. Motion, please.
So moved.
Derek moves.
Second.
Slow down just a second.
All right,
We got papers flowing everywhere. All right, I'm sorry.
No, that's
Because that
fine.
was Derek.
Derek moves. Love seconds. And whenever you're able.
Okay. Patrick.
Yes.
Lorenzen.
Yes.
Chittick.
Yes.
Ludington.
Yes.
Let's carry. Next is the oath and bond for William McCord, trustee, Metcalf Fire Protection District. Need a motion and a second, please.
So moved.
Derek moves. Andy seconds. When you're ready.
Patrick.
Yes.
Lorenzen.
Yes.
Chittick.
Yes.
Ludington.
Yes.
Okay, that carries. Next is to authorize chairman to execute lease with the Edgar County Housing Authority, and that would be the leases for the building there on the north, what would it be, east corner there, right by the Housing Authority, that for use by the Edgar County Sheriff's Department. Yes, John?
Do we still have some, the sheriff's department was all out in the hallway, just to talk about the need for the additional space.
I don't know whether they're out there anymore.
They're probably gone.
I went out there, I think Carl's been out there. Have you been out there?
I haven't been out there yet, but I've talked to
Yeah,
Scott.
they've got-
I've been in there before, I'm just,
The issue, I'll tell you what I know, but it's gonna be second, well, it's not necessarily second. We, with the 911 board moving their facilities because of equipment growth and need for space, they built that, what would be the southeast corner of the jail, which is the newest portion. And we currently are using that for interrogation, for the deputies' rooms, for investigation, for evidence, and that, a lot of that will go away. They've got this out here where they've got 2 interrogation rooms, they've got a training room for the first time for deputies, they've got office, et cetera, for detectives, and they've got a space for evidence. So they say they need it, and
The good news is the interrogation rooms, the new building has spigots for waterboarding, so we're in the game.
well, and I've been in the old rooms, it is a bit of a rat warren going up to the 3rd floor of the old county jail, but, you
that was our understanding, John.
know, okay.
Motion to approve.
So moved.
Andy?
Second.
Derek seconds. When you're ready.
Patrick.
Yes.
Lorenzen.
Yes.
Chittick.
No,
And Ludington.
Yes.
I vote yes. Because we need 4 to approve anything.
Got Voight. Yes. 4-1.
All right. Next item is reappoint Roger Stanley and Susan Saxton to the Edgar County Board of Review, each for 1-year term. They would all be coming due next year at this point, or actually, yeah, at this point. Any questions? Motion to approve?
so moved.
John? Andy? When you're ready.
No, just the appointment.
Oh, that's, all those in favor signify by saying aye.
Aye.
Opposed, nay. I understand.
I will probably do that until we have.
I vote yes too. So,
You know why?
Okay.
yes, I know why.
And there's no discount to these 2 people. That's not what I meant. They're nice, they're good people.
Next item is resolution to reappoint Pat Road, trustee, Human Fire Protection District. Motion and a second, please.
So moved.
Derek moves.
Second.
Love seconds.
Okay.
Be-
Patrick,
Yes.
Lorenzen,
Yes.
Chittick,
Yes.
Luddington.
Yes.
Okay, oath and bond for Pet Road, trustee.
So moved.
Derek moves.
Second.
John seconds.
Patrick,
Yes.
Lorenzen,
Yes.
Chittick,
Yes.
Ludd.
Yes.
Okay, did we hear from Dina at all?
She didn't answer the phone, I'll keep trying.
Okay. We have no officers, well, we have Augie once he gets off the phone.
If you don't get a holdover, we could do that Monday too, or what
Yeah.
we do, if you'd rather wait, you
Yeah.
can.
I just, I'm sure you guys would like to know how much it is that we're
Yeah.
approving for the flight and ask any questions. Do you gentlemen have any reports that you would like to give at
Hey,
this point?
have you seen Dina? I need to speak to her. We're still in the meeting.
We're about 70, or a little over 70,
What are you supposed to do?
basically, with all the smart lock projects.
Thank you. We need to know the dollar amount.
It slowed down
of
quite a
that
bit
bid
by the
for
COVID
flight.
thing, but they're finishing up at the health department, they're going in the evenings and weekends and finishing up what they've got to do down there.
And the name
Okay.
of the company.
And the name of the
So,
company?
I've got them here working on the new heating cooling system today. I think he said there's it's called a thermistor, but it's some type of thermostat. Yeah, that sounds good, doesn't it?
So that's why it was cold Monday?
Huh?
Is that why it was cold in here
That's why
Monday?
it's cold Monday.
Okay.
I told you guys it was a thermistor issue.
That's more expensive than just the.
That's
They're
right.
all thermostats.
Thermistor's about double the cost.
950.
You can use those on the aircraft carrier.
Yeah, that's right, that's right.
So other than that,
Okay, but that's the bid that, okay.
So was that just an
Company name?
oversight on the bid or the agreeing to take on the engineering firm or other period via the airport? Hanson?
Yeah,
That was the only reason why.
Yeah, that's the only reason why
3 years,
uh,
5 years?
Tom was supposed to, I think, call Augie, or I was supposed
Oh,
to
but we
tell
only do
Augie,
it
and we didn't
once
do
every
that,
3
so
No
years.
worries.
4,
we
thank you.
need to
Got
get
it.
that
All right,
on the
thanks,
agenda
Mike.
and get it passed.
So we
Okay.
have to reapprove that every year or
We have
something?
No, it's
Okay.
every three.
He's ready, I can.
What's the
I
time
can do it.
frame?
4 years.
Do it.
But yeah, it's just one of those routine.
I mean, we had another person put in their packet, but.
Yeah.
And it really doesn't talk about price, it's
No.
just, it's just their ability and their track record. Okay, we'll go back to 12. No, which one is it? Oh, the aerial 10. 10. So where are we at on that, Augie? You talked to Dina?
Yes, one bid by a company called Ayres, A-Y-R-E-S. And the dollar amount was $45,950.
That's pretty comparable to where it was 3 years ago.
and that was the same company that has done it in the past, and she was good to work with them, good to work with, so.
Yeah, and shoot, they were excited about it. Of course, they've saved up for it, and that will be
That's
till
a-
next year.
That's a requirement, right? Over so many years.
Motion to approve the bid.
So moved.
Derek moves, Lud seconds. Do we need a motion or a roll call or just a regular vote?
I don't have a resolution or an ordinance.
All those in favor signify by saying aye.
Aye.
Opposed, nay. It is carried. I'm sorry, we kind of waver back and forth here. It's kind of an unusual day, so are there any other committee reports to work on? Okay. Do we have a need of a closed session for personnel or other issues? Okay, last item, do we want to discuss any about our plan forward, or do we just want to think about what we've heard about and have the letter and some of the stuff that we talked about start working on, or how do you want to?
You said there's a letter being written?
Yes.
Follow up?
Yeah.
That's something go out there?
Well, hopefully in the next day or two. That's going to deal with the governor's response and asking him cordially to respond to us.
Because, I mean, I assume that at some level, on the executive branch, we have a contact, we can just go, hey, what's up?
It has been. In fact, the Counties Association director saw it and he resent it for us. And then asked the governor and his staff to reconsider how many regions are there that the governor is acting upon right now? They've broken down and made a new recommendation.
We're in 6, but they talk about 4 regions, and there's more than that number, so.
Right, when we're lumped together with what, 6 and 3? At any rate, what they're asking is that it is not appropriate to be lumped in, that they should break it down into like the EM, the Emergency Management Districts, which boils it down to about 17 counties instead of us being lumped in with 30-some counties. So they are supporting our efforts and the way we're going about it. Now, whether that means anything, I don't know. Does that answer your question?
Yeah. But so as far as a response, we haven't heard anything.
No, we have not as of right now. Additionally, we're also working on with the hospital and Paris and anybody else who would like to be involved in steps and guidance that we at least have a rough draft that we could discuss at the next meeting. Okay?
I assume the steps and guidance would be very similar to what the state has for their, what they call phase 3 and 4, whatever their phases of reopening are.
Right. And we need to make some effort to clarify the health department's.
Yeah, just with the things said today, I'm wondering, and this isn't viewed as a cop-out, but maybe trying to play both sides where we are officially, staying with the state program, however, also giving our health department some guidance and making sure the public knows exactly where they stand.
That's what
And so I need to look at some more, but that's kind of what's in my head right now is.
Do you want a couple of us to go out and meet with the board? Or department board? They met this morning at 7. I don't know.
That's fine.
I'm looking for guidance as what everybody thinks is appropriate.
I mean, big picture, I think, obviously, united front from both, Paris and Crispin city governments and ourselves. Also, as far as covering everybody to the max extent possible, everything we do at least looks something like the state program, so we can go, hey, look at this, we did X, Y, and Z just like you asked. Those things, and I guess when I'm saying that, open up as much as we can, but also have some look back or some touch on what the mandate is. So if we need to ask for help, we say, hey, we're following as closely as we can what you're asking. But I think the biggest piece of this, in my mind, from everything we've heard, is talking to the health department, make sure we're on the same page and they know where we stand. So.
Well, and I don't want to speak for the health department. I'm not sure that they aren't, but I'm not sure that they will say that they are. Does that make sense?
I think that needs to be worked out.
I know, that's what I'm telling you.
They've been very quiet through all of this.
That's an issue right there.
That's what I'm saying.
Yeah.
And that's.
So do we need to ask Janet to be at that meeting on next week, or is it more the board?
I think we need to explore that. Okay? I don't know. I think that is an issue, problematic.
I think if we can get their buy-in and have their help in having a reasonable plan to get people opened up and having everyone else have buy-in that, hey, the health department's here to help, they're going to make sure that you are in line with most of your liability concerns, you're following the rules as far as the social distancing and numbers, that can be a big tool in our toolkit as far as getting things opened up safely. is having the health department on board and doing extra, potentially extra work to keep us in line.
Is it the health department who is in charge? This is all of the health department. I know the governor said that was who's in charge, but is that who's in charge of enforcing the executive order?
No.
Right.
Well, insofar as, I think there's a concern there, just like they give your health ratings A, B, and C,
Yeah.
that is a power they possess, and if the health department is saying you're not following the COVID specs, you're now a C or whatever it is, you're unsat.
Right.
Then
I don't have a problem with guidance from them on that, and I would welcome guidance from them on that.
Right. I think, in my mind, that's where they have their power, right, the health department. They're not gonna come in and arrest you, right? They're gonna say, you know, this was an A restaurant, now it's a D or whatever it is, right? And I could be wrong, there's some other power they possess
Don't they,
as
can
far
they
as.
take your, don't you have to have a certificate?
Yeah.
They can take that, can't they? Or
No,
can they?
I'm not doing anything wrong.
No.
You have
I
a
agree.
license that's issued by the state.
By the
right?
state, so the state has to come and do
But
that.
I assume the health department has some sort of sign off as you apply for your state license.
Right.
So that, their power there exists only as you reapply for a license.
Upon their inspection.
That would be.
You
the
can pay a
part.
yearly
Annual inspection.
license, and then they inspect twice a year.
Yeah, and if you fail the inspection, I assume they have the power to pull the license.
Or I don't know.
Their recommendation is
they can recommend, and I'm
Okay.
not so positive in that.
And
As
this
far as
some
the
point.
governor's order, the only best we can come up with, and it's being adjudicated in the press and in law and courts throughout the state, is the only people that can uphold the governor's demands, or whatever you call them, his criteria, is IEMA.
Right.
They're the only ones that are, the state police can't do it, the county, the
By
health
statute.
department, none of us.
There it is.
So that's where the enforcement rests. But then it's complicated by the fact that the governor can only declare an emergency 30 days, period.
Right.
It's up to the legislature to give him authority to declare it beyond that.
Right.
Or do anything beyond that. And by the time it all gets adjudicated, the catch-22 on this deal is he's buying time.
Right.
I mean, all this time is eating up the time he wants it to take to do what is going to be impractical for our small businesses to have to live with and exist.
Well, and that's the other side of the coin, right? So I would expect our health department and our regional hospital to give us guidance as well, because it's not just, you know, helping small businesses, it's also keeping people safe and healthy, not ending up where we have a high concentration of infection.
If you look at what happened in Wayne County, the health department gave a cease and desist. The state's attorney said, well, I don't see a clear and convincing case to shut them down. I don't, so they consequently didn't. So at that point, really, the health department became more of a arm of helping keep things safe versus trying, which they couldn't shut them down. So it became locked up in the courts.
If we can avoid that at all costs, I mean, it would be nice to be a united front on all of this, right? Like, so the state's attorney, the county board, the health department, all parties concerned are on the same page. So that's what I kind of view this next meeting about, is if we can get all those parties, you know, together and talk it over, or at least get position, if Mark has one, as far as what our legal obligations are otherwise.
We can try.
Yeah, because we're much better off working with them than against them if we can. Yeah, we create a lot of problems trying to work against them.
Does anybody have a problem with Kirk making a comment? No.
Just as a point of an input, there's been statewide a commingling of the enforcement of executive orders versus the powers of the health department. One thing the state has adopted is the pandemic influenza plan. It's controlled by Department of Public Health. If you read that document on page 66 and 67, it will give you some great directives. They specifically said this staying at home is not effective. It's in that very document, but that's what we all did. It also talks about why it's not effective, and they point to the destruction of the economy. It's a very well laid out and adopted plan, and the health department has the power to work through that plan. And the important thing they point out, and the appellate prosecutor's office addressed that in their opinion as well, in our Constitution, people have rights to take care of themselves. They're responsible for themselves. And the government doesn't play a role of big brother. If you read those documents in that plan, specifically page 66 and 67, it's some great directives for your health department who may not have even read it. And it gives folks a little bit of comfort as to how things are supposed to work.
And this is, what document is this?
It's the Illinois Pandemic Influenza Plan. It is actually from IDPH, and it is part of this emergency disaster program. Within that, it outlines why we do or don't do something, and we're actually doing things contrary to the IDPH's plan. And we've tried to get that addressed through press questions, and we've not been able to, but it does have some good information that the public can be better informed as to what is or isn't really supposed to be going on. The health departments, man, I'm all for keeping everybody healthy, but we have to do it through due process, and like you just explained, if there's one case I know here in Edgar County where the state's attorney took no action, and we're trying to get a copy of the letter, but we know for a fact that no action was taken to shut that business down. And that's the process. If people want to take that decision, that's on them. It's not really this complicated. It's complicated because we're issuing executive orders versus health department powers. Executive orders are enforced by IEMA. Health department powers and liquor control powers, they can have local police help them enforce it. But when the police are going out in some places, they're saying, we're here to enforce the executive order. No, you don't have that power. And that's where all of this commingling comes. And we've talked to some police that have said straight up, hey, we're being told to do this. We don't necessarily agree with it, but we're doing what we're told. Well, that's not how our system of government works. So I would encourage everyone, before we take a hard stance on anything, ask two questions. Says who, what proof? What's the law say? Because the law is crystal clear. That's all I have. Thank you.
Well, I think what you would like me to do is to get as many of our team together that we're trying to work with together at this next meeting, so that we can get clarification, or if they're not willing to give it, at least we realize what there are. So,
well, and I think just talking about that, doing our due diligence, doing our best as far as public health and safety is concerned. Part of that is keeping people from being so desperate that they're opening up on their own and doing whatever they want based on their idea of how that affects their business strictly from a business standpoint, right? So if we get everybody's buy-in and we're saying, hey, we're going to open up, we're going to have health department buy, just making sure you're doing all you can, that we're all on the same page. I think that's better than people to say, screw it, I'm opening up.
I received a letter from Janet, and I can't find it. I've looked online. It basically says that the health department, under her signature as director, would like the county to continue to follow the governor's guidelines. So that's their written opinion at this point. Sam, did you have anything to add to this right now, this discussion? I know I talked to Ollie yesterday. I didn't know whether you had anything.
We are fully open for business. It's not just hurting small businesses, it's hurting healthcare in general. And we know the heart attacks and the strokes are not stopping. We know the congestive heart failures are not stopping, but our numbers have drastically decreased by more than 50%. For the first time in 12 years, I've had to send nurses home. So I don't know what more we can do to reassure our county that we have 0 positive cases, and that if they feel scared, it's okay. But we have resources and options to help them get their health care where they feel comfortable, whether that be at the curbside, whether that be through a drive-through, whether that be through telemedicine, or whether that be through sending an ambulance to them. But we are open for business, and whatever we can do to spread the message that we want them to be safe, but we also want them to be healthy.
Maybe I'm talking out of turn, but you're also coming up with a plan to open the hospital back up to allow patients to, on a limited basis, to receive visitors. I don't think you've initiated that yet, but it's coming, right?
If they're doing, so our elective surgery cases have opened back up. Our surgeons are calling the patients that had put their surgeries off in the past and letting them know that they're scheduling cases. And they're allowed to, if you're having surgery, most of the time you need a driver anyway, so they are allowing a visitor, at least one visitor, during the surgical procedure. That visitor's screened, they're provided a mask. But yes, we are allowing hospital patients to, on a limited basis, have screened visitors.
By the way, just when I turn my phone back on, we have no positives. We've tested 214. Negatives are 203, and we have 13 pending. Okay? Just so you'll know that, hot off the press as of today. All right, gentlemen. We'll see what works, and on Monday or Tuesday, some towards the first of next week, we'll get back together. Yes, John.
I don't know if you want to hear, but for scheduling a special meeting, I would try to avoid Monday for my personal
No problem.
need.
No, that's fine. That's fine.
If I can't be here, I can't be here, but
No, that's fine. We can do Tuesday or Wednesday, or Thursday night, Friday night, or just a little humor. Augie, do you have something to report from your office as far as
5 o'clock,
reports?
that works.
That's all day today.
As soon as they're done.
Yeah, I would just like to report that we're working through fairly quickly the entering of the levy data. So I'm pleased with the progress. We obviously have a little ways to go yet, but we're moving forward, and I think the training has gone well for my newest employee, so I'll keep you updated.
Great. Thank you. Most of the offices are working and getting through this time with minimal inconvenience. I know the highway department's out plowing snow or whatever they're doing this time of the year. Yes, sir.
The letter you got from the health department said they want us to follow the governor's.
Their recommendation is that we follow the governor's guidelines.
Does that mean they are anti-opening up?
That's all it said.
I kind of shut the door a little bit there. Just guessing. Hope not.
Remember not either. Is there anything else to come before the meeting, Augie? Did I miss anything?
Somebody switched it.
Motion to adjourn.
So
Derek moves, Andy seconds. All those in favor signify by saying aye.
Aye.
Opposed, nay. We are adjourned. Don't forget you got stuff to sign, guys.